The body is an interconnected organism, so what's happening in one area is impacting another area. 50% of Americans have imbalanced blood sugar levels where they are at risk of prediabetes. That's another early warning sign to be, looking for and really changing your lifestyle around.
What are some of the nutritional and lifestyle choices we can make around each of those?
In my clinical experience, I would say that
Brigid Titgemeier is a functional medicine registered dietitian who helps people transform their health by using food as medicine. She is the founder and CEO of BeingBrigid Functional Nutrition and the Being Collective, guiding over 25,000 people, including Fortune 500 CEOs, through personalized nutrition strategies. Previously a founding dietitian of the Cleveland Clinic Center for Functional Medicine with Dr. Mark Hyman and an adjunct instructor at Case Western Reserve, Brigid is at the forefront of integrative nutrition. Her work's being featured on The Today Show, Goop, Mind Body Green, and more. Stay tuned. This is a conversation you won't want to miss.
What are the biggest health challenges women face, and how do nutrition and lifestyle choices influence them?
it's a great question. So I would say that women across the board experience more conditions than men because of so many different changes in our hormones, potentially the exposure that we have to environmental toxins, our toxin exposure, our inability to fully detox them and excrete them. Our gut microbiome is directly impacted by our hormones. Our blood sugar regulation is also impacted by our hormones. So, women across the board are at a higher risk of many different conditions. For instance, 80% of autoimmune disease happens in women. Migraines are much more commonly happening in women. IBS, much more commonly happening in women. Two-thirds of Alzheimer's disease cases are in women. Hip fractures and other conditions, osteoporosis, significantly higher in women than men. And then we have the metabolic picture of high cholesterol, high blood sugar, cardiovascular disease that women are at a higher predisposition to, especially as they go through perimenopause and menopause because of the changes in estrogen that are more cardioprotective. And as women lose them, if they aren't on hormone replacement therapy, can actually increase their risk of heart disease, type 2 diabetes. And this is independent of age. So it's not just that women are aging at the same rate as men and then experiencing these diseases, but it's that their risk is higher, uh, specifically related to the changes in hormones that they experience. So, in my clinical experience, I would say that the women that I see most often are dealing with um, a few different things. One, metabolic issues, whether that's blood sugar imbalances, whether that is cardiovascular disease, high cholesterol, those sorts of things. And they want to be able to use nutrition and lifestyle interventions before jumping to the prescription pad, like their doctors typically will jump to. The second thing is various inflammation related conditions. So this could be anything from autoimmune disease to a lot of joint pain or period pain or those sorts of things where we see the underlying causes typically being related to chronic inflammation and a lot of GI issues. So, whether that's a diagnosis of IBS or IBD or bloating or constipation or diarrhea or just feeling like they're not fully digesting their food, that those are probably the three most common things that I see and work with women on. And I think a lot of women are faced with and experiencing. In addition to that, they're also more often being misdiagnosed and dismissed for a lot of their symptoms. So we know that even when a woman is going through perimenopause, I believe she sees 5 to 7 physicians before she actually gets the proper diagnosis or the proper information that she needs in order to optimize how she's feeling. Also, when you look at women who are experiencing endometriosis or PCOS, the actual time to a proper diagnosis can be up to 10 years of experiencing the debilitating pain and symptoms that are associated with these diseases until they're properly diagnosed. So, in addition to experiencing more disease at specific periods of life, women are also not being given the answers and often dismissed by healthcare providers across the board.
Mm. It's incredible, isn't it, when you just list off all of those health conditions that women are facing disproportionately. And you highlighted there 3 really key areas of focus, I guess, that we can focus on changing, as you said, in terms of lifestyle and nutrition changes, which were, metabolic blood sugar that you talked about, the inflammation, and the gut. Can we dig into each of those a little deeper? Because I would love to be able to share with listeners some of the things that they can do from a nutrition and lifestyle perspective to influence those 3 key areas.
Of course, I would love it. I would also say that a lot of women will be told when they go to their doctor and they ask, "Is my nutrition associated with this? Should I change my diet?" They're often told no. They're often told, "No, nutrition has nothing to do with this," or, "Okay, you can try to eat healthy, but there's not much that you're gonna be able to change as far as your actual symptoms or experience." Some doctors are getting better with this, but we hear this all day long from women that we work with that their doctor is telling them that nutrition and supplements and lifestyle are essentially either a waste of time or helpful in the general context of overall health, but not necessarily something that can move the needle as far as reversing their symptoms. And I see the exact opposite of that recommendation every single day from women who are reversing their migraines to their joint pain to their congestions to their IBS to their mood imbalances and mood swings and anxiety and difficulty sleeping. All of these are directly associated with nutrition, so I would absolutely love to dive into them more.
Actually, I'm gonna ask you before we dive in, because I think that connection is really important to understand. And I'm thinking if someone's tuning in, they may not understand this component of it. So when we think about research, obviously, initially when we look at research, we think about like the direct relationship between 2 factors. So say, for example, we're honing in on something like high cholesterol and looking at blood sugar. But what we now know as we've gathered more and more research is that a number of these things that we are talking about actually impact a number of different health conditions. So, say, for example, something like blood sugar, as you listed off, and I'm going to get to you to talk about this in a moment, does impact a number of different health conditions. So when we are looking at, just say for a moment from a preventative perspective, looking at addressing that and shifting that, we're not only shifting and reducing the likelihood of gaining one disease, we're actually looking at preventing potentially a number of diseases. Can you explain a little bit more about that relationship between those 3 factors that we're talking about and a range of health conditions?
I think that you bring up a good point, and it's that the body is an interconnected organism. So, what's happening in one area is impacting another area. And a few examples of that would be the even correlation between blood sugar and inflammation. So, when you have higher levels of blood sugar that are uncontrolled and you're experiencing a lot of fluctuations throughout the entire day, this will increase your underlying levels of chronic inflammation. We also know that blood sugar is directly tied to hormone balance. So, a lot of women will want to jump to hormone testing, for instance, because most women are just convinced that their hormones are off. And now sometimes that can be the case. Other times it's that their thyroid is actually off, or their cortisol levels are off, or they have blood sugar imbalances. Blood sugar imbalances are incredibly common because blood sugar impacts so much of our overall hormone health. And then we have the integration even between hormones and inflammation. So, as we see a woman's estrogen levels going down through menopause, we also see chronic inflammation levels rising because the estrogen helps to offset some of that inflammation. So, everything is completely interconnected. The gut microbiome is another example. Most people think about just lowering their carbohydrate intake when they think about blood sugar control, and they completely miss the fact that their gut microbiome is a key regulator in our overall blood sugar regulation. So the actual microbes that you have living in your large intestine and your gut microbiome, they are impacting your ability to control your blood sugar, whether you're eating a high carb or a low carb food. And a lot of this is bio individual. So each person is going to have different blood sugar responses to different foods, but a lot of that is being driven by the microbiome. So, for instance, if a person completely cuts all carbohydrates out of their diet, That would also mean cutting out a lot of fiber sources and prebiotics that actually help to fuel a lot of the beneficial microbes that help with blood sugar regulation. So all of it is completely interconnected and it completely drives our symptoms. Not only, like you said, our risk of disease, when we think about the key chronic diseases that are directly tied to nutrition and lifestyle, Alzheimer's disease, heart disease, cancer, type 2 diabetes, but then also looking at osteoporosis for females because that's a enormous risk for a lot of women, and then looking at the role that symptoms play. So most of the time we're thinking about, in our world of conventional medicine, treating disease. When you go to the doctor is taught to treat disease with typically pharmaceutical interventions or a surgery. When you move to a different approach of thinking about disease prevention, then we're talking about preventing those diseases that I mentioned. And then I like to take it even a step further to think a little bit more upstream to look at symptoms because symptoms can tell us so much about different imbalances that are happening in the body. And when we pay attention to them, it can often be something that we are able to address proactively to not only reverse the risk of chronic disease that could potentially be down the road, but also feel really good in our day to day lives so that we're able to function. And one example of that is even like with Alzheimer's disease, it doesn't just develop overnight, right? This is decades in the making. And typically we'll start with things like cognitive impairment, mild cognitive impairment. And so when you're ignoring the symptoms, you're basically ignoring the initial signs of potential disease, where when you're able to address them, you're able to identify the imbalances that are happening underneath the surface, can set you up for feeling good on a daily basis, functioning at a higher capacity, and then also preventing disease and hopefully improving your overall health span.
Absolutely, and that's such a important point to highlight is not always waiting till the problem arises, but as you said, the focus on not just prevention, but everyday life and feeling better, having more energy, feeling more able to focus, concentrate, creativity. So it's all of those things that when we are eating well, when we are doing the things that we need to take care of ourselves, we can get the best out of our everyday life experiences. So I want to go into those three. What are some of the nutritional and lifestyle choices we can make around each of those?
I think a lot of it starts with blood sugar. A lot of it starts with improving your blood sugar control and thinking about not even just eating well, but eating intentionally so that you're able to improve the blood sugar response that you have after meals. So 50% of Americans have imbalanced blood sugar levels where they are at risk of prediabetes, or are experiencing prediabetes, type 2 diabetes, gestational diabetes, and gestational diabetes also sets you up for a higher risk of both prediabetes and type 2 diabetes. So that's another early warning sign to be, looking for and really changing your lifestyle around. So when we look at the onset of that in blood sugar disturbances, we want to think about improving the way that we are structuring our meals instead of just thinking about eating healthy, right? Because there's a big difference between eating a bowl of oats and having them be quote unquote healthy and doing it in a way that helps to actually support blood sugar. Because oftentimes, oats do contain very beneficial properties. They have beta glucans and that are a specific type of fiber that have been shown to improve cardiovascular disease risk and other biochemicals that or other chemicals that are able to modulate various aspects of our overall health. But if you're going to eat a bowl of oats by itself, that's not going to be very beneficial for overall blood sugar control. So we want to think about layering in enough protein and healthy fats in order to help with improving overall blood sugar control. So essentially, not eating carbohydrates by themselves is a great first step when it comes to thinking more intentionally, so that you're layering in the protein, you're layering in the healthy fats to help to support overall blood sugar regulation. When it comes to inflammation, I would say that eating whole real foods is absolutely the first step. Trying to eat as many whole real foods as possible so that you're removing inputs that are going to hijack your physiology. So when you think about, the difference in your underlying cellular function when you're eating a diet that is filled with things like your uh, French fries and other highly processed foods compared to a diet that contains blueberries and leafy greens and turmeric and chia seeds, these food sources that are abundant in not only micronutrients, but also phytonutrients. So, phytonutrients are these underlying molecules that are essentially similar to antioxidants, but they have this incredible role in combating inflammation so that you can essentially neutralize inflammation as it's happening underneath the surface. And when you're eating a diet that's higher in a lot of processed foods that have more of these inflammatory compounds, it will accelerate inflammation, which accelerates oxidative stress, it accelerates aging, and will also increase glycation. It increases our overall risk of pretty much every single chronic disease. So, the majority of chronic diseases actually do stem from higher levels of chronic inflammation. And so, using that foundation of eating mostly whole foods is so incredibly important for combating that and allowing the body to properly neutralize underlying inflammation. Because acute inflammation isn't a problem, it's when there's chronic underlying inflammation that's beginning to brew and continue to persist that becomes super problematic when we're talking about the development of symptoms and decreasing functionality and then the development of chronic disease.
Sorry, can I just get you to explain that difference, between an acute and chronic, inflammation or
So, inflammation as a whole is not a bad thing. Acute inflammation is designed to essentially help us survive. So, when you get an injury or a cut, you have different responses that the body is primed to be able to handle in order to prevent you from essentially like bleeding to death. Or when you develop an infection, the body, your immune system, it increases acute levels of inflammation so that you're upregulating some of these inflammatory molecules to help to protect and fight off the infection. Chronic inflammation, on the other hand, it doesn't have a turn off button, whereas acute inflammation is able to kick up. It identifies when it's resolved the problem, and then it dies down. Chronic inflammation, there is no end button. There's no stop, and it continues to persist and brew because you're chronically exposed to things that are telling the body that it needs to continue fighting. So this can be higher levels of environmental toxins and pollutants. This can be higher levels of compounds in your diet that are increasing levels of inflammation. This could be from smoking. This could be from overall sedentary lifestyle that doesn't help with actually, neutralizing some of that inflammation. And so it will tell your body to continue fighting as a way to keep your body to serve as a way to help your body survive. And so the things that we want to avoid are keeping our body in this state of feeling like it needs to be fighting things off at all times so that our inflammation is able to neutralize and ideally even switch to an anti-inflammatory state so that you're neutralizing free radicals and decreasing oxidative stress and allowing the body to operate at a higher potential.
Thank you. I think that's an important clarification because I think we can start to think that it's, all inflammation is bad, but that a difference between acute, which is maybe more functional, and that chronic inflammation that can have long-term negative impacts on our body is really important.
I completely agree. And I think a lot of times people think that inflammation is just all bad because we
Yeah.
lump it all together.
Mhm. And can you explain that third key area, which is the gut?
Yes. So the gut is the epicenter of our overall health. We have hundreds of trillions of microbes that live inside of us, and being able to protect their overall health is extremely important for decreasing the risk of chronic inflammation, of hormone imbalances, of blood sugar dysregulation. It impacts so much overall. So, in order to support gut health, you want to do the two things that we talked about for blood sugar control and decreasing inflammation, eating more whole foods, limiting a lot of those ultra processed foods in particular. And then also, from a blood sugar standpoint, trying to incorporate enough protein, healthy fats, and fiber. Fiber is really one of the key aspects of overall gut health. Obviously, a lot of people will talk about probiotics, which are also beneficial, but we have fibers, we have two different types of fibers, soluble fiber and insoluble fiber. And specific types of soluble fiber are actually they exert anti-inflammatory compounds because they're prebiotics. So they themselves don't actually do this, but your gut does this. Your gut bacteria does this when you're consuming these foods. So when you consume a food that has higher soluble fiber that functions as a prebiotic, your microbes actually secrete something called short chain fatty acids, particularly butyrate, which is the most common short chain fatty acid that exerts anti inflammatory compounds and mechanisms throughout the entire body. So it is like an on switch for being able to lower inflammation across the board by working in favor of your microbiome. And one thing that I will say is that we have a lot of women who are experiencing gut microbiome issues, and that is the stem of potentially their GI issues, but it can also extend further than that. Gut health, because it impacts everything, a gut imbalance could show up as something like brain fog. It could show up as something like fatigue. It could show up as something like anxiety or depression because we know that 90% of a person's serotonin levels are produced in the gut. So, gut imbalances can present in a number of different ways. And a lot of times the recommendation will be, oh, just eat more fiber. And for some women, this can be problematic because as you're increasing fiber, if you have underlying GI imbalances, the harmful bacteria will eat the fiber and it creates fermentation, which creates excessive gas and bloating. So it can feel really problematic to eat these fibers. So in a lot of those cases, that could be super frustrating for a person that's trying to figure out why they're having these symptoms. And that's when really working with a functional practitioner and being able to dive deeper into exactly what's happening can be so incredibly beneficial. A lot of GI doctors today are getting more on the bandwagon of recommending low FODMAP diets. And while they can be beneficial, low FODMAP diets will essentially decrease overall fiber consumption, but specifically a type of carbohydrates that are in a category of what FODMAP stands for. And it's fermentable and disaccharides, monosaccharides, and polyols. And so it's a bunch of different carbohydrates that will cause more GI irritation. Low FODMAP diets can be effective short term interventions, but we don't often jump to them as a first step because they also decrease the diversity in your microbiome. So it's actually problematic to be on a low FODMAP diet long term. So the goal is to identify the underlying disturbance, whether that's bacterial overgrowth in your large intestine, whether you have small intestinal bacterial overgrowth in your small intestine, meaning that the bacteria that should not be in the small intestine is creeping up into your small intestine. Sometimes that can be because of stomach acid issues. Stomach acid is helpful for actually killing off the bacteria that should not be in your small intestine. And so when you have imbalances there, it can lead to more bacteria in your small intestine. It could be issues from a leaky gut standpoint, meaning that you have increases in intestinal permeability. This is a term that is often discussed as leaky gut. And when you have leaky gut, this can also create more issues from a GI standpoint. So really the key is to work with a functional practitioner and look underneath the hood so that you're able to identify what the core issue is so that then you can use a targeted nutrition and lifestyle approach to improve the outcome. And I think the problem that so many people are facing right now with the increase in podcasts and books and all the information at your fingertips is that it seems like it's just an easy solution where like, oh, this person is saying to do this, to eat more fiber, to eat more probiotics. And so that's just not the case for everyone. And nutrition is, of course, very specific. It's not one size fits all. What works for one person is not going to work for the next. And so, figuring out what you need in order to resolve your overall gut health is something that I would highly recommend and encourage.
That is such an important message because you're right. It's fantastic that we have so much information available and we can access that more readily. But at the same time, I think that people are taking that on as, okay, I need to add this vitamin. I need to eat less of this food. I need to eat more of this food. I need to do this. I need to do that. And as you said, it really comes back to the individual. And I love that example when you're talking about FODMAP is that, we're using a broad sweep of sort of saying, all any of these foods may be causing issues for you. So we're eliminating all of them at this key point in time to kind of do a reset. But what we really want to do is get to the bottom of what are those foods for you? Rather than eliminating every possibility, we want to know the key things that are actually impacting your health. And then you're applying that more broadly to all of the information that we're obtaining and sort of saying, we need to put it through that filter of our own individual situation and our own context. And the best way that we can do that is with a health professional like yourself going in, maybe doing some tests, looking at, our own lifestyles, our own factors, our own health situation, and then figuring out what is the best nutritional plan for us as an individual.
100%. Because even when you think about so I think because we're trained by conventional medicine to think about it as just like, oh, if you have high cholesterol, go on a statin. You know, um, if you have issues with allergies, take Benadryl. If you have issues with this, take that. And so it's not as simple as that because of the body being such a complex interconnected organism. And so even thinking about something like IBS, irritable bowel syndrome, it may seem like, oh, everyone with IBS should just follow this protocol. Everyone with IBS should just decrease their FODMAPs and then go on their way. And there are a million underlying causes of IBS. So one person could have IBS because they have a dairy sensitivity. Another person could have gluten sensitivity. Another person could have high levels of stress that are, being that are presenting as IBS. Another person could have, issues with GI motility. Another person could have issues with leaky gut that's caused from ongoing use of, acetaminophen for too many years. I mean, the list goes on and on. And so being able to pinpoint what's working for you and then also your underlying root cause, regardless of the diagnosis, is so important.
Absolutely. And I think also recognizing that sometimes it is a bit of a trial and error process and it is a bit of an individual experiment also that you're running. So you need to then check back. So it's not just, normally like you'll try something, but you also want to check back. Is that working? What's that looking like now? And do we need to adjust that? And that's also an important part of the process. And I think why it is so important if you are facing these sort of health challenges or if you just want to take care of yourself to find that individual practitioner that can work with you around your unique set of circumstances. So important. We obviously also know
100%.
there's such a strong connection between gut health and inflammation and mental health. And there's, more and more research emerging around that. What does the research tell us about that gut brain connection and inflammatory pathways?
So the gut and the brain are bidirectionally communicating. So your gut is communicating with your brain and your brain is communicating with your gut. And so this is incredibly important for us to think about when we think about root causes approach to our mental health epidemic because we do have, an absolute epidemic of 26% of adults in the United States having a diagnosable mental health condition. And the research is very clear that nutrition plays an enormous role in mental health outcomes. And so I'm not saying that that's the case for everyone and it is not a solution for everyone, but for many people it can be. So there's an emerging field at Harvard called nutritional psychiatry that essentially refers to this idea that there is strong evidence between nutrition, mental health, and the gut brain connection. In one study, they looked at a 12-week single blind randomized control trial, and they found that there is absolutely a connection between nutrition and mental health. There was another study that was done looking at 5 randomized control trials, and they found that eating a Mediterranean style diet was associated with improvements in depression and mild to moderate depressive symptoms in young to middle-aged adults. And this highlights the fact that one, nutrition plays an enormous role in our mental health for likely a few reasons. One, improving our gut health because we know that gut and mental health are directly tied, that 90 to 95% of serotonin is produced in the gut. But then also looking at the role that blood sugar plays in our mental health and the way that that likely impacts things, the way that nutrient deficiencies can impact our overall mental health, knowing that there is established research showing that even deficiencies in nutrients like magnesium can impact our central nervous system and our ability to uh, decrease symptoms like anxiety. There is a lot of data that also shows the role of B vitamins and the way that B vitamins can impact depression and anxiety, with increasing rates of depression and anxiety when people have certain B vitamin deficiencies. So I think that the tie between nutrition and mental health is very well established in extremely reputable journals, prestigious journals that are looking at random double blind randomized controlled trials or single blind randomized controlled trials that are showing the fact that we need to be incorporating nutrition into the conversation for mental health. And I would say especially for women, because we see significant changes in female mental health, especially in the perimenopause years. So as women's hormones are fluctuating more significantly throughout menopause or throughout perimenopause, this increases mood swings and anxiety specifically. And most women are going to their doctor and they're talking about these symptoms that they have never had before and saying, I think it's at a specific time of the month that this seems to be happening, probably when my hormones are shifting. And they'll typically leave with a prescription for an anti-anxiety medication without looking deeper into the role that these hormone shifts are actually playing in mental health. And so I think whether a woman is going through the postpartum transition, even pregnancy transition, perimenopause, menopause, these significant states that we go through as women are directly tied to our mental health and increased rates of both depression and anxiety.
Absolutely. That holistic approach that you're talking about is just so important, and it's so positive to see those shifts happening already around, adopting more holistic approaches to mental health and health more generally. I wanna ask you a question, which I'm really fascinated to hear your answer on. If you had the power to redesign the healthcare system, what changes would you make first?
I would make a lot of changes.
I know you would. Which is
I would
why I
make a
can't
lot
wait
of
to hear your
changes.
answer.
And, for context, I would like to say that I worked within the healthcare system. I worked at the Cleveland Clinic for many years, fortunately on the functional medicine side and starting the Center for Functional Medicine at the Cleveland Clinic 10 years ago. I also have worked in academia for the last 8 years, teaching a graduate level course in integrative and functional nutrition through the Case Western Reserve School of Medicine that I co-created the curriculum for 8 years ago. And so I've directly seen the deficiencies in our healthcare system, not only in clients and patients, but physically in working in these environments and in seeing, some of the training that future practitioners are getting. The changes that I would make in healthcare would be, 1, focusing more on bringing nutrition to the center of our healthcare, bringing our plate to the center of our healthcare, because 90% of our healthcare expenses, at least in the United States, are attributable to nutrition and lifestyle interventions. So 90% of the more than $4 trillion that we're spending are because of chronic diseases that are originating from nutrition and lifestyle needs that are not being addressed in conventional healthcare. So the first thing that I would do is bring that to the center by educating more physicians in medical school around the importance of nutrition education. We are seeing a shift in this with more medical schools embracing even culinary medicine labs. I know that the Cleveland Clinic School of Medicine in their new facility spent a ton of money on actually creating a culinary medicine teaching kitchen for medical students, PAs, dietitian students. So they actually are going into the kitchens as essentially, like, you could think of it as like a lab that you would have in chemistry or biochemistry, but it's in a kitchen that they each have their own kitchen lab, and then they're making different meals based on therapeutic nutrition interventions and the evidence that has been shown to improve specific outcomes for patients. So this, I think, is absolutely huge and an enormous step in the right direction to be able to address the role of nutrition. And I don't even think that we need to prioritize or expect doctors to be able to help us in every single aspect of our health, but I think having that baseline knowledge and understanding to say nutrition is absolutely involved here, and I would recommend working with a registered dietitian, someone that has a lot of expertise around the coaching side and around the actual, like mechanisms and frameworks that work is so huge. I think that's the second change that I would recommend is extending our healthcare team outside of the doctor because we put so much emphasis on the need that the doctor has to have, and it's unrealistic expectations for the doctor to go through 30 appointments a day from patient to patient to patient that they're meeting with for 15 minutes at a time and then say, I can't believe you didn't take the time to talk about my nutrition and lifestyle, right? The system is setting doctors up for failure, which is what's leading to accelerated rates of physician burnout. And so the second thing that I would say is expanding upon the healthcare team so that people are thinking outside of that. Physical therapists, thinking about acupuncturists, thinking about a holistic approach to healing and who is on your team when it comes to your healthcare team and optimizing your overall health. The next change that I would make is creating a more intentional patient physician relationship because I feel that the relationship piece is drastically missing in current healthcare and that there is no other industry in the world that gets away with treating their clients the way that doctors are able to get away with and still continue to have repeat business. And so I think emphasizing the healing role of a physician to patient relationship is so incredibly important. And you could insert any practitioner there, whether that's a psychiatrist or it's a nurse practitioner or it's a dietitian or whoever the practitioner is. Having a person that knows you instead of feeling like you're just a part of the revolving door, going from whoever is open and available, I think is also extremely important. So those would be the top 3 that come to mind as far as just like a starting place. I know that there's a lot more to address than just that, but those would be the start.
I love all of those. And, when you're talking about that last one, I think it's so important, that relationship, because obviously it's about the trust in that relationship, but it's also about the information. I really feel for doctors as you're talking about their 15-minute time slots. Like, how do you possibly have the information that you need to be able to make effective decisions when you've chatted to someone for 15 minutes? Like, similar to my work and your work, that when you are first meeting with someone, you're gathering so much information, and that context is so important in terms of the direction that you take with that individual, in terms of understanding their own goals, where they want to go, how they want to direct their health. So, if we don't have that relationship, if we don't have the time for that relationship, it really sets everyone up to fail. And I think that even just changing that is so important. But I love all of the suggestions. I'm on board for all of those, particularly the more let's get down the health promotion prevention end and turn that tertiary end into a more holistic approach so that we can see better outcomes for everyone. I also want to ask you about myths you've encountered because I'm sure you have encountered many. What is a myth that you've encountered around health or nutrition, whether it be on social media or more generally out there?
So there is pervasive messaging on social media of this all foods fits mentality or eat everything you want in moderation. And typically it stems from dietitians or nutritionists that historically have had eating disorders or who's a lot of clients have had eating disorders and so they push the narrative of there is no bad food, you can eat all foods in moderation, and I could not agree less with that approach. I think that you can absolutely have an intentional healing approach to nutrition that improves your overall relationship with food, that decreases shame, that decreases judgment, that increases your level of self acceptance, while also having standards around the foods that you choose to allow to enter your house and that you allow to enter your body. And so we get comments from clients on a regular basis who say, I really wasted a lot of time trying this like all foods fit approach or this eat everything in moderation. And the issue is that a lot of these foods are set up to increase our overall cravings and desire for these foods. And it becomes very difficult to eat them just in moderation. So when you're eating Skittles and you're trying to do this practice of incorporating intentionality behind it where you're eating it just a few times per week and you know that it's in your cupboard, for a lot of people, they're not going to be able to stop thinking about those Skittles. And you can have a very healthy relationship with food and that still be the case for you. Or, people who are like, I just do much better without bread in my cabinet. And I don't need to include bread in my house in order to have a healthy relationship with food. So the eat everything in moderation or all foods fit or there is no such thing as good foods and bad foods. I do agree that I don't think that we should think of it in terms of good and bad foods, but absolutely, there are optimal foods and less optimal foods. So we need to be honest about that and help people understand if the limitation for you eating healthy or you eating optimally is because you are honestly always craving food or you're stress eating, it might be the foods that you're allowing in your house on a regular basis and needing to increase the boundaries and the discipline that you have around that. And so I think that that is definitely one that really uh, I do not agree with. A second message that I think can be problematic is that it's just about calories in versus calories out, or this eat less, move more. This is very pervasive in a lot of male fitness accounts that I see, or a lot of even male physicians who will argue online to other people. It's just calories in versus calories out. And that might be the case for men, and obviously calories absolutely matter, but when you're looking at hormone regulation overall, and something that I hear over and over from women, especially as they hit their mid-40s, is I haven't changed anything with my diet and physical activity, and I'm just gaining weight around my abdominal section. And so this can be because of changes that happen with our metabolism as we age. But I also, just in looking at the research, believe that it is independent of aging and also hormonally driven as well. And that we need to be taking a more holistic approach to nutrition when it comes to supporting improvements in body composition. So instead of just thinking about it for weight loss, thinking about improving strength and muscle and bone health in order for us to age well and to feel good and decrease our risk of chronic disease instead of just getting to the lowest number on the scale. But then also being honest that 100 calories of broccoli is not the same as 100 calories of soda. They just are not the same. They're not the same as far as the way that they will impact your hunger hormones, the way that they'll impact your cravings and desire to eat more foods, your ability to sleep at night, which also then helps to control your overall metabolism the next day. We know that even just one night of poor sleep can increase ghrelin levels, decrease leptin levels, which is our satiating hormone, and can also increase inflammation and other markers. When you look at the research, people that have been intentionally sleep deprived in research studies will typically eat more calories the following day, and they will eat more calories that are focused on highly refined carbohydrates that they feel a higher need for after a night of sleep deprivation or a few nights of sleep deprivation. And so the food choices that we make, they impact our sleep. And so when we think about all of these things that are connected, 100 calories of broccoli is not the same as 100 calories of soda, and it is not as simple of an equation as eat less and move more. I truly believe that many women are over exercising and that that's the reason that they can't lose weight. Many women are under eating and over exercising, and that's the reason that they can't lose weight because they're not actually properly fueling their metabolism. So I think there's a lot of nuance around that discussion of eat less, move more that also disheartens me when I see people on the internet try to make it seem so simple where it's just like, why don't you work harder? Why don't you have more willpower? Why don't you stop being less lazy instead of having a more nuanced conversation?
Absolutely, and that nuance is so important, even when you're just talking about sleep, like, the amount of directions that goes in terms of, like, if we're sleep deprived, then we don't wanna go and exercise, or we're not doing those things that we need to do, and as you said, the hormone changes in women around those 40s. Also, we see a lot of those sleep issues, so being able to have that holistic approach is so important in getting the outcomes that you're looking for.
And I think too with health advice that it can be super frustrating when you're in a phase like that and then you see things like, "Oh, sleep is so important for longevity and extending our health years," and, "Oh, just focus first on sleep." And even just in going through pregnancy and being postpartum over the last several years with 2 pregnancies, sometimes you literally cannot control how well you sleep. And it's like, let's think about this in a broader context of helping you get better quality sleep, in addition to, of course, the regular habits of proper sleep hygiene and having blackout curtains and making sure that your temperature in your room is cool enough and making sure that you're going to bed around the same time and having an unwind routine. But for a lot of women, they will still wake up in the middle of the night and not be able to sleep. And so nutrition plays an enormous role. If you feel like, oh, I've heard that I should just start with sleep, I do agree with that rationale. But if you are having issues with sleep, nutrition may be the first place because of nutrition's ability to improve our overall sleep quality.
Absolutely, that makes so much sense. I
And you
wanna
might need some
ask you
hormone replacement therapy and some magnesium.
and some other stuff as well. But this is the key, right? Is that, like, when we are talking about these things, that there is nuance to everything, and we do need to put it in that individual context. So I love that you're reinforcing that message. What are 3 small but powerful actions that women can take to improve their long-term health?
One, having the confidence that you're capable of being able to do that. I think that if you have an identity around trying different diets that haven't worked for you, feeling like a failure, feeling like you're never going to be able to get it right, that being able to remind yourself of the power of neuroplasticity, the brain's ability to actually change and to generate new patterns, is so incredibly important. So you are never too old. It is never too late. These changes can drastically impact your overall life, and if it's possible for one other person in the world, it's possible for you too. The second thing would be eating more whole foods to help to counteract some of that inflammation and identifying the need for specific nutrients. Like we talked about, nutrient deficiencies can play an enormous role. So, being able to make sure that you're eating more whole foods that are also nutrient dense, that are giving you those nutrients like the B vitamins and the magnesium. So thinking about leafy greens, thinking about even like wild salmon, thinking about organic chicken, even because chicken will have more B vitamins than some of the plant based foods, and then lentils and beans and other foods to help to round that out. The third recommendation that I would make is decreasing alcohol. So, just along the lines of the sleep conversation, alcohol, with more and more people wearing wearables, they're able to see the direct effects that alcohol is having on their sleep quality and their HRV. And so when we look at these scores, just one drink can impact your sleep quality and your HRV, which is essentially a measurement of your overall resilience and is correlated with improved health span and decreased risk of cardiovascular disease. Alcohol, especially if you're used to trying to unwind with alcohol at night, can be, you know, not beneficial for anyone. And so I would say trying to decrease your alcohol intake. This will also likely help to improve your diet overall because we see as people decrease alcohol consumption, their sleep improves, which improves their hunger hormone balance, which improves their ability to say no to foods that aren't actually working for them, and then also decreasing a lot of the cravings that they were experiencing previously.
I wanna ask you one last question. If you had a magic wand and could instantly give every human one skill or insight, what would it be and why?
To learn to be your own health advocate and to be able to do that in a way that aligns fully with your health goals without feeling bad about doing so. So, not feeling bad about asking for the additional labs, paying attention to your symptoms, paying attention to the signals that your body is sending to you, and being able to articulate that in settings with your doctor, being able to look for doctors that are, you're fully in alignment, looking for expanding your healthcare team to practitioners that help you dig deeper into what's happening. I just think that being your own health advocate is such an important skill that leads to being able to be more consistent with a lot of the behavior change when it comes to the most important basics of nutrition, sleep, stress reduction, and movement, in addition to, of course, relationships and having meaning and purpose in life. But then also thinking about the ability to look deeper and to ask the right questions without feeling like you have to accept being dismissed or made to feel like you're crazy.
That is huge, that one alone. And I was just thinking when you're talking about, particularly as women, that we are so good at doing that when it comes to our children, but not as good as doing it for ourselves. And maybe it is applying a little bit of that lens of like, what would you do if this was your child, to your own situation and how you advocate for yourself. Thank you so much. You are absolutely a wealth of knowledge. And I know you have some fabulous programs because I know people are listening and you have covered so much in this episode. And I know myself sometimes I've actually done one of your programs because it can be really hard as someone who's not trained in nutrition to get that balance right in terms of, ticking all the boxes that we might need in terms of our nutrition. I shouldn't say ticking the boxes because it's not about ticking the boxes, but fitting everything on the plate to meet our nutrition needs. And what I love about your program is not only do you provide really easy to follow food programs with shopping lists and all that sort of stuff that's super handy when you're busy, but also that you provide a lot of knowledge and learning and information alongside that. So it's not just a sort of situation where you're doing this kind of 6-week program and then you're going back to life without really having changed your understanding and your relationship with food. So can you just tell our listeners a little bit about, one or some of those programs that you offer? Because I'm sure some of them might be interested.
Oh, thank you so much. Yeah, so I have a membership program called the Being Collective where we pull together weekly meal plans that my dietitians create. Our entire focus is on helping to decrease inflammation and to help you learn to use food in a way that addresses some of the root causes of what's happening underneath the surface and eating in an anti-inflammatory way. So we do the weekly coaching calls with my dietitians and I and have the weekly meal plans and an incredible community. Ask me anythings in order to help again with that information component of it, because the information, as you said, I feel like information is power, especially when it comes to being able to stay consistent with the lifestyle changes that you're trying to make. Having the right information for you is can be such a powerful lever. And so we run the Being Collective. We have new cohorts that we run every month, and so that's a great way. And you can find any information out about the program. You can take my quiz in order to better understand like what works best for you, because some people that do have more health needs, and have worked with practitioners where things have not worked out for them, and you're really struggling, that you might want a more in-depth nutrition program where we're running labs and we're better understanding your nutrient deficiencies and those sorts of things, which is also something that we offer. So all of that information you can find at beingbrigid.com, my website, which is just being and then my name, BRIGID.com.
Perfect. And we'll put all that in the show notes as well. Thank you so much for your time. I really appreciate it, Bridget.
Thank you so much for having me, and thank you so much for all of the work that you're doing.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.